Hi, I'm Carrie, a stroke survivor and bind member.
And I'm Kezia, stroke survivor as well and my bind member. And today we are going to be introducing Karen Stull, who is a speech language pathologist and a board of director of Bind. She's has her experience as a speech therapist for brain injury survivors and also for spinal cord survivors. So welcome so much.
Welcome, Karen.
Thank you guys for having me today. I'm excited to be here.
Welcome to Bindwaves, the official podcast of the Brain Injury Network of Dallas. I'm Brian White, Bind's Executive Director. On each episode, we'll be providing insight into the brain injury community. We'll be talking to members and professionals regarding their stories and the important role of Bind's Clubhouse. We work as a team to inspire hope, community, and a sense of purpose to survivors, caregivers, and the public. Thank you for tuning into Bindwaves. Let's get on with the show.
So right now that you're with us here, can you tell us a little bit about yourself and your career and how you even became a speech language pathologist?
Okay, well that's a lot. So
Yes.
I'll try to be brief. So I have been a speech and language pathologist. It will be 17 years this May, which is really hard for me to believe that I'm that old to have that much experience. But I guess to answer your question about why I became a speech therapist, I never thought I was going to be a speech therapist. My mom was a speech and language pathologist, so I always knew about that as a career option. So when I was in college, I was struggling a little bit with what I wanted to do, and I put my sights on audiology. So audiology and speech and language pathology, it's the same bachelor's degree. And my senior year of college, as I was applying to audiology programs, my dad was diagnosed with a laryngeal cancer. So that left one of his vocal cords paralyzed and also left him with a pretty significant dysphagia, which is problem swallowing. So that kind of changed the course of my career path, and I became very interested in swallowing disorders and voice disorders, and that steered my ship in a different direction towards speech and language pathology.
Oh, wow. Yeah. I'm going to be learning a lot about you today. This is our first time meeting in person. And I'm like, she's a board of director. And I'm like, well,
It's okay. I don't really know much about her either, so I'm going to be learning all about her too.
Ask away. Yeah.
So now I'm curious. What do you do as an audiologist?
Well, I am not.
No, I know you're not, but I know that you said that.
So what does an audiologist do?
I've never heard of that.
So an audiologist is a medical professional who their main focus is on hearing.
Oh.
Like perhaps maybe helping a patient who has a cochlear implant, getting that calibrated correctly, and that is probably not the right term to use. I'm not an audiologist. And then teaching them how to then apply what they're hearing to what the sound is.
Oh, okay.
So sometimes audiologists will work in that capacity. They'll also work with helping people with hearing aids and just different disorders of the ear.
Okay, interesting. Like I said, I didn't even know that was a thing. But so I know, like, you're a Baylor Scott and White, and you used to work with brain injury survivors, but now you're working with spinal cord. So that just got us curious. Mm-hmm. So is it similar, like the speech therapy problems or speech problems between brain injury and spinal cord, or is it just totally different?
Well, I think I'm going to answer that in two different ways, if that's okay.
Yes.
So I work with patients who have spinal cord injuries with a co-occurring brain injury.
Oh, okay.
So a lot of what a person with a spinal cord injury needs to be able to do if they are not able to move their arms is to be able to direct their care. So can they remember the steps to instruct a caregiver on how to perform an intermittent catheterization if they're not able to physically do that on their own? That's a way to void their bladder. Or do they need help to remember the steps to do a bowel program because their body may not be able to have bowel movements on their own anymore? That type of thing. Also, different abilities to just direct their care for other things. A lot of swallowing issues in that population, especially if the injury is in their neck. And sometimes voice disorders as well if they can't generate enough power because perhaps the muscles that we use for breathing are impacted from their spinal cord injury. So some of it's very different, but some of it's very much the same, just maybe more applicable than sitting down to do like a worksheet like you might have done with your speech therapist in acute care or inpatient rehab.
Yeah, I think that's really interesting because we have had various speech therapists come in and talk about speech therapy. And I think that as brain injury survivors and the people that we most currently that I've experienced or met here at Bind, a lot of it is aphasia and our difficulty communicating. So I think it's really cool to be hearing about like swallowing and like different issues, especially for spinal cord survivors.
Can I just say,
Yeah.
I don't want to hear about the swallowing. I had to do thickened liquids. So.
I'm so sorry.
Yeah.
It's no fun.
No, so I understand about
No
the
fun.
swallowing.
It's no fun.
Yeah. Yeah, I think so
sorry.
too. No, but you're right. I think at some point maybe all of us, or the majority, or many of us had to do that, stuck in the hospital.
Yeah.
But
And it's not something that the speech therapists enjoy either. We don't enjoy telling someone, sorry, you have to be on this liquid that looks like, Jell-O.
No,
Like,
and I do appreciate that all the speech therapists that I had that made me at it, that they promised me that they had tried all of them.
oh, yes.
So
Yeah.
it makes you feel better to know that they actually tasted it. But I quit drinking coffee. It was so bad. I was like, I'll just drink water.
That's fair. That's fair.
interesting.
Yeah.
Interesting. Did you really have to taste everything? She just said it. So I'm like, what?
In graduate school, that was what our professors where I attended school had us do. They said, if you're going to be prescribing this for your patients, you need to know what you're asking them to do. So it was where I went to school, it was required.
Wow, interesting. Oh my gosh. Wait, back to what we were talking about, spinal cord.
Sorry, I know. I apologize. I got you.
I'm like in my head, I'm like, wow, well, that's good. Good that you had to do that to be feeling like you understand what we are going through as brain injury survivors. But I did like how you connected spinal cord injury and if it happened like on your neck and like on your brain, because a lot of them, and this is just a question too, just through personal experience or meeting people, is it like something that you can be diagnosed with, or can someone literally tell you because you've had a spinal cord injury, you can also include that into the brain injury, and are they told?
So a spinal cord injury would be a separate injury from the brain injury.
Okay.
So my patients will have an injury like an assault to their brain where they hit their head hard enough to cause damage to their brain, but they also may have been in an accident severe enough where they had injury to the spinal cord, so the nerves within the spinal cord were damaged. Does that better answer your question?
Yes, no, but I guess, so can you have a spinal cord injury without having a brain injury?
Yes,
I think
you can.
that's kind of what we were wondering,
Yes,
too.
you can have a spinal cord injury without a brain injury.
Okay.
Oh, okay. Yeah, I guess because I was just confused as to like the communication between your brain and your spinal cord that is damaging a certain, obviously like physical, like movement, but also like anything. Does that equal to being a brain injury? But you're right. I think that made it a lot more clear. So thank you so much.
Oh, you're welcome. Probably didn't do a very good job of explaining it to begin with, so my apologies.
Yeah,
for
no,
that.
it's good.
Well, and the next thing we have on here is one that we talked about we're going to ask. So what are some of the other things that, a speech therapist has to work on or work with? And like I have swallowing down because I know that's a big issue. Could you maybe, I guess, even though I said I don't want to talk about it, explain for our listeners why brain injury and or spinal cord survivors have the swallowing issue and why that's such a problem?
Okay, so it could be dysphagia or problem swallowing could be caused by a multitude of different reasons, right? So for someone that has a spinal cord injury, I'm going to use that to start off with. Many of my patients who have had an injury to their spinal cord also need surgery where... Sorry.
It's okay.
It's okay.
Where as surgery is performed, where an incision is made on the anterior neck, the trachea is moved out of the way, and then some of the other muscles that we use for swallowing are also moved out of the way to make a clear path for the surgeon to stabilize the anterior neck. Well, when we do that, there can be, or not we, I'm a speech therapist, I'm not going to be doing surgery, but when the surgery occurs, there can be, you can pull some of the nerves that we use for swallowing, and you can also clamp down on the muscles that we use for swallowing, so that can decrease the blood flow to that area. And then there can be swelling afterwards, and just dysmotility, or just the movement of the muscles just isn't very smooth, and the swelling can prevent full range of motion. So when that occurs with a patient with a spinal cord injury, it prohibits the muscles from doing their correct job, and then food and fluid can get into the airway. And then if that occurs, we can develop a pneumonia over time, which can, in some cases, be fatal. But it can also prolong hospitalization, and, pneumonia just really makes you feel really bad.
Yeah. Interesting. So you had mentioned you were going to start off with spinal cord, and then how does that affect for brain injury survivors?
Sure. So for someone with a brain injury, it could be that perhaps you had an injury to your brain in the area that we actually initiate a swallow. So perhaps maybe the brain stem, which does a lot with swallowing and also initiation of movement too. You could also have an issue somewhere on the motor strip where you have trouble with the muscles for swallowing, or perhaps it's an issue with initiation. So at the point in time when you're having trouble swallowing, are you having a hard time with detecting that something is in your throat that you need to swallow, or could it be a coordination issue? So are you actually coordinating the muscles in a timely manner to swallow in a way that protects you?
I was sitting here listening, and I'm trying to think back, like, what was mine? And I don't really remember, but I do know, and I hope I say this word right, that I still on occasion aspirate, which to me just means it went down the wrong pipe, and that's what we always say. But because and I guess that's what it is in your brain when you've had a brain injury. Mine was on the right side, so somewhere in there it affected where I was not swallowing properly, and so I was on thickened liquids and pureed foods.
Oh my goodness, I'm so sorry. That's terrible.
I know it is. I tell everyone I made the mistake one time. You're trying to be different, and I ordered a pureed ham and cheese sandwich. I don't know what I was thinking, but I did not eat it.
I don't blame you. It does not sound like that. It tasted very good.
Yeah. So I think I only had to do my swallow test twice before I passed get back on
really
regular foods. But I know I still aspirate sometimes, and I'll be at the dinner table, and my parents start freaking out. They're like, Carrie, put your hands over your head. Oh, hi, Mom. Have you met me? My left arm doesn't raise over my head. And I just go, I'm just like, give me a minute. It'll pass.
Well, I will say that most adults aspirate at some point during the day, regardless of brain injury or spinal cord injury. It's just a normal part of being a human. Our esophagus is right next to our airway, so it's poor design, in my opinion. I didn't design the body, but it does lead us open for aspiration to occur, even if there's no problem with swallowing.
Yeah, I actually, while you were talking, Carrie, I was like, wait, that was my question. So one of the things that I was wondering about is, like, we always talk about, like, the side of the brain that we ended up damaging, Carrie said the right side, mine was on the left side. So, like, what really affects, like the function of, like, swallowing correctly? What would affect there?
That's a very difficult question to answer, because the area that we use to swallow is kind of all over the brain.
All over, okay.
So that's how I would answer that question. So you can have a left hemisphere stroke or a right hemisphere stroke and have trouble with swallowing depending on where exactly it was.
Okay. Like I said, learning every single day, especially on Thursdays, because the podcast is on Thursdays. So anyway, so I think that, like, we were talking about, like, and Carrie mentioned it a couple of times too. Like, it's really hard to be swallowing and, like, to be following instructions.
Of course.
Like, from people when you're not at that point yet. So before moving on, I do want to recommend people that while you're listening to us, make sure to like us on all forms of platforms, whether it be Spotify or YouTube, whatever. Make sure to like us and tell other people about us. Make sure to like and subscribe and blah, 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 blah. Do it. Okay, so back to what we were talking about. So how would you communicate with others? And especially if, like, they're in the hospital in the really hard accepting moment, how do you engage other survivors to listen to you, you know, and follow the instructions and do the best that they can.
Well, I mean, in my opinion, this is Karen's opinion.
Karen's opinion, yes.
Karen's opinion.
That's what we're looking for.
I think you have to meet the person where they are. You know,
Right.
you have to realize that what they're going through is very difficult for them. And their goals may not be the same goals that my goals are. So I want to make sure that my goals match what my patient's goals are, because if they don't match, we're going to be competing against one another, not working together as a unit. I think education is important. If I'm explaining to my patient, this is where things are now, this is what you need now, and this is how we're going to get to your goal, that typically helps the situation more so than if I go in and say, this is what you have to do.
Right.
Because it's ultimately your choice as the patient on what you do. I'm just going to give you the tools to help you make it to your goals.
Yeah.
Does that make sense?
It does make sense. And I'm trying to think back. I think for me, basically what made sense to me was they told me, you can choke to death if you don't do what we're telling you to do. If you get too much of something down the wrong pipe, then you can literally choke to death. And that's not what we want you to do. So,
Yeah. And I think that also, you had mentioned too about speech pathologists. You do a lot of different things. I think we had also talked to other speech pathologists, how to manage like cognitively, like the issues that are more cognitive issues, and how to encourage them as well to be doing these. And I think that what you mentioned, like aligning the goals, you know, not the doctor's goal, not the speech therapist doctor's goal, it's our goals, like as survivors and like what we do. And do you also, this is just like, I think you do this, but when you have patients, do you also talk to like their caregivers, their family, or?
Yes. So first, you do have to have, you know, if the patient is their own decision maker, you do need to get the permission to talk to their spouse or caregiver, their moms or dads, whomever that might be. But yes, I do engage them in therapy sessions if the patient's agreeable to that, because the injury is not only affecting the patient, but it also affects the family members and the family dynamics. So, and sometimes if my patient's having a hard time remembering something, they may convey information that may not be correct. So I want to make sure that the family member also feels comfortable with any of the information or education that's provided.
That's kind of what you mentioned in the beginning, talking about more of the cognitive side of speech therapy, especially being spinal cord survivors, and possibly brain injury. They have less lack of mobility with their arms to be able to, because I know a lot of the things we've heard, you know, when we're talking about aphasia, it's like they encourage them to use their hands and to point and to do the, you know, I want a glass of water, so I'm going to act like I'm drinking, you know. Well, so that's a totally different way about going around speech therapy, I guess, with that kind of issue.
So for spinal cord injury in Texas, there are really only 2 rehabs that can manage those patients, and that's Baylor Downtown, Baylor Scott and White Institute for Rehab in Dallas, and then Tier Memorial in Houston. We're the only 2 model system spinal cord injury hospitals in Texas. So that being said, what I do is a little unique as a speech therapist because of the amount of hospitals that are in the area that can provide those services. Does that
that's interesting.
So it's not something that everyone, that every speech therapist would do.
Right.
I know when I started.
It's very unique.
It is.
It's interesting, though.
It is interesting. And it took a lot of outside learning.
I bet.
Yeah.
So I guess one of the things, too, so how did you hear about Bind? I mean, we're glad that you did. But.
Sure. So when I first moved to Texas, that was about 17 years ago, I don't believe Bind was yet started. But through, you know, the medical industry, we'll call it that.
Yeah. All the therapists know each other.
We all talk. We all know someone that knows someone. And then I met Allison Jordan through work, and that's, but I had also met Valerie at one point in time through the Baylor system. So I knew about Bind and then got to know more about Bind through my friend Allison.
Okay, we miss Allison.
Yeah, I do too.
For our listeners that don't know, Allison is a previous board member, and she has moved to Florida.
Yes, she's in Tallahassee.
But she is a big supporter of ours, so we do miss you. If you're listening, Allison, we love you and we miss you. Sorry.
I hope she is listening.
That would be so fun. Yeah.
Yeah. And how do you like being a board of director, and how's that going?
Well, I'm still, I've been on the board of directors for about 6 months, so I'm still kind of learning my role and where I can be the most helpful, because it's a new role for me, and I want to be helpful, and sometimes I'm not sure if what I'm doing is or not. So,
Well, I definitely agree. I mean, I definitely appreciate, as a member of Bind, like the different perspective that you are having as a brain injury and spinal cord. It's like something that I don't learn about a lot about. I mean, in all honesty, brain injury overall, like right. I'm everyday learning. So definitely appreciate your perspective. It's really interesting.
Thank you.
And it is. And I guess I would just ask, it doesn't have to be necessarily just brain injury, but spinal cord. So what is like that one thing that you think that you would like everyone that has nothing, that they know nothing about brain injury survivors, that would be important for them to understand and know? Like,
ooh, that's a tough question, Carrie.
I know.
I guess not to assume that someone can't do something, because many times what I notice is people who aren't medical, when they hear brain injury or spinal cord injury, they assume someone can't do something.
Right.
And they overhelp where maybe it's not needed. So I guess the one thing I would say is don't assume that someone can't do something, and allow someone to try.
Yeah, I think that's very good advice. So, well, Karen, we want to thank you so much for joining us today, and we learned something new, and that's always great. So also, we're going to get some information from you later, but if somebody wanted to, if they had more questions about, since spinal cord is so different, and there's only apparently 2 places you can go, if you have a contact information that we can add into our show notes, we'd like to include that just in case someone wants to shoot you an email.
Perfect.
Yeah. So, and because I know you're at Baylor Scott and White downtown.
Mm-hmm. Yes. But again, we would like to thank you for coming and joining us for this episode, Karen. And we would like to thank all of our listeners to logging on and listening to Karen and Carrie and I for this podcast.
And don't forget, if you'd like to contact us, you can email us at bindwaves@thebind.org.
And like I said earlier, don't forget to like, share, subscribe, and also hit that notify button if you're on YouTube while listening to Bindwaves.
You can find us on all your favorite platforms. Thanks, guys. Until next time. We hope you've enjoyed listening to Bind Waves and continue to support Bind and our nonprofit mission.
We support brain injury survivors as they reconnect into the life, the community, and their workplace.
And we couldn't do that without great listeners like you. We appreciate each and every one of you. Continue watching. Until next time.
Until next time.